Hi and welcome to the third part of Class 1 Malocclusions webinar. In this third part, we will go on with some cases. Class 1 crowding case with a transverse discrepancy. The patient is 23 years old with a chief complaint of crowding of his teeth. In clinical examination, this 21-year-old patient was not happy with his smile. He wanted to correct his teeth. He presented class 1 features with a nice profile and smile line. Both molars and canines were in class 1 relationship. Midlines were on with the face, but the arches were narrow, and as a result, upper and lower moderate crowding was present. Panoramic X-ray revealed that there were no room for third molars. He is periodontally healthy. According to cephalometric analysis, patient was skeletally class 1, normal vertical pattern, and retroclined lower incisors. Treatment plan was leveling and aligning the teeth, expanding the arches with wires, and apply interproximal stripping for lower incisors together with proclining them. Bite blocks were applied to the lower second molars in order to open the bite and prevent upper teeth from disturbing the lower braces. At the end of treatment, crowding was resolved and arches were expanded and teeth were aligned. Upper and lower fixed retainers were bonded. The arch sequence for this treatment was starting with 0014 Nitai arches, then 0016 by 0016 Nitai, and then 0018 by 0025 Nitai. And this was the leveling and aligning sequence. Then for finishing, 0021 by 0025 stainless steel arches were used. The patient's smile line was improved, and as seen in panoramic radiograph, everything is in place and lower third molars were extracted. Final cephalometric evaluation shows that both upper and lower incisors were proclined without disturbing the lip positions. And this is the cephalometric superimposition, and this confirms that the proclination of incisors are done. The expansion of the arches at the posterior segments are clearly seen in before and after records. Class 1 malocclusion with diastemas. This is a 14-year-old patient with a chief complaint of the spaces between his teeth. This 14-year-old boy consulted us to close his upper midline diastema. He had a good facial and profile aesthetics and a nice smile line, presenting class 1 characteristics. He had a class 1 molar and canine relationship, deep bite, prominent upper midline diastema, and upper molar rotations. Panoramic X-ray revealed impacted mesiodonts between upper central incisors. So the treatment plan was the extraction of mesiodonts, leveling and aligning of teeth, retraction of upper incisors, and establishing final occlusion. Immediate surgical extraction of the mesiodens was performed before orthodontics. After orthodontic treatment, you can see that the diastemas were closed and upper and lower fixed retainers were bonded. The arch sequence for this patient was 0014 Nitai arches at the beginning, then 0016 by 0016 Nitai arches. After leveling and mass retraction was performed with 0018 by 0025 stainless steel wires. In this patient, sliding mechanics was used. For the last phase of the treatment, 0021 by 0025 stainless steel arches were placed. This is the end of treatment, and we can see that the smile was improved. After debonding, lower right first molar was sent for root canal treatment. This is the end of part 3 for Class 1 malocclusions webinar. See you in part 4. Hi, welcome to part 4 of the treatment of Class 1 malocclusions webinar. So we will go on with the case reports. This is a Class 1 crowding with extractions. A 26-year-old patient, and the chief complaint is the appearance of teeth and anesthetic smile. In clinical examination, this young adult lady was unhappy with her smile and crooked teeth. She had a straight profile, competent lips, and a symmetric face. She has a narrow smile, limited with only incisors and canines. Molars were in Class 1 relationship and canines were almost Class 3. She had a severe anterior crowding. All teeth, including the third molars, were present in the mouth. She did not have any TMJ dysfunction. In cephalometric analysis, she is skeletally Class 1. She had normal vertical pattern and slightly retroclined incisors. Extraction decision was made for resolving the crowding. So our treatment objectives were extraction of 4 premolars, leveling and retraction of canines, leveling and aligning the occlusion, and finishing in ideal Class 1 occlusion. Upper and lower first premolars were extracted, and the spaces were closed, resolving to crowding and carrying canines to Class 1 relationship. For the retraction of canines, sliding mechanics on 0018 by 0025 stainless steel wires was used. Upper and lower fixed retainers were bonded following debonding of the braces. Patient was really happy with the result, and now she has a better smile line. Although this patient had thin lips, extraction did not have an adverse effect on her profile. Rather, profile was improved together with the smile. So this is the panoramic X-ray after debonding. At the final cephalometrics, you can see that the incisor inclinations improved a little bit despite the extractions. Another case with class 1 crowding, lower incisor extraction. This is a 19-year-old patient with chief complaint of appearance of teeth and anesthetic smile. Clinical examination. The patient has a concave profile, very thin but competent lips. He has a narrow smile and a low smile line, and the crowding is highly visible in his smile. He is dentally class 1 on molars and canines on both sides. He has a central incisor crossbite and a lower incisor out of occlusion. In panoramic X-ray, periodontal tissues look fine, but some interdental caries can be observed. There is no space for his third molars in lower jaw. In cephalometric analysis, he is skeletally class 1. His lips look very much retruded, but this is mostly because of the nose. Upper and lower incisor angles are normal. The treatment planning was opening space for the tooth 21, raising the bite for leveling, extraction of the tooth number 32. This is normally not a favorable extraction type, but in this patient, although one incisor is out of the dental arch, the canine occlusion was already class 1. So this is a very suitable case for incisor extraction. Then leveling and aligning and establishing final occlusion. So first upper arch was leveled except 21. Then the bite was raised using a blue resin on molars. The crossbite was corrected by elastics. The treatment was finished by detailed leveling and aligning. After the removal of braces, his soft tissue profile remained almost the same, but he had a big improvement in smile aesthetics. He was advised to remove the third molars. In cephalometric evaluation, the incisor inclinations and the soft tissue profile did not change at all. And this is the superimposition of before and after cephalometrics. And this is before and after treatment. You can see the abrasion caused by the crossbite on the left central incisor. This usually happens in adult crowding cases. Teeth are worn because of wrong occlusion, and they usually need some restorations after the orthodontic treatment. And this is the end of part 4. See you in part 5. Welcome to the session 5 of the treatment of class 1 malocclusions webinar. Treatment protocols on class 1 deep bite. An 11-year-old patient with a chief complaint of appearance of teeth and crowding. The clinical examination. This 11-year-old girl consulted us with chief complaint of crowding. She has a slightly convex profile with a little gummy smile, but at this age, it's acceptable. As seen in intraoral pictures, patient has class 1 molar relationship on both sides. Left side upper and lower premolars are newly erupting, and upper canines are trying to find space in the arch. Bite is too deep that lower incisors do not show. Panoramic X-ray shows second molars are on the way, and the patient is ready for fixed treatment. Cephalometric evaluation shows normal vertical pattern with skeletally class 1 malocclusion, but acceptable profile. Upper and lower incisors are retroclined, far beyond normal, with upper incisors 88 degrees and lower incisors 86 degrees. So our treatment objectives are leveling and aligning of teeth, correcting deep bite, finishing in ideal occlusion. Leveling and aligning was urgently started with fixed appliance in order to open the bite and create room for upper canines and lower incisors. You can see the arch sequence as following. Fixed retainers for upper and lower jaws were bonded after treatment, and second molars eruption were followed in every 6 months. Final extraoral photos show how profile and smile line was improved. Final cephalometric X-ray shows how upper and lower incisors were proclined, resolving the deep bite. Patient is still a growing adolescent and was recalled for 6 months intervals. Early treatments are vital for correcting deep bites, but as the patient is still an active grower, second and third molars eruptions should be followed. Before and after treatment superimpositions reveal that upper and lower incisors were proclined in favor of bite correction, and the patient grew in downward and forward direction during the treatment. This is the improvement of the occlusion in 22 months. The improvement of the smile and growth of the mandible is clearly seen in before and after photographs. Class 1 open bite and transverse discrepancy. The age of the patient is 22, and the chief complaint is crowding, biting, and chewing. Clinical examination. Competent lips with a symmetric face, slightly narrow smile, but nice teeth projection in this smile. She has a very nice soft tissue profile and the position of the upper incisors are looking fine in lateral smile. She has a severe anterior open bite. She is almost class 1 on molars and canines, but she has a crossbite on the right side. She has large fillings on lower molars and caries on the upper molars. In panoramics, it is seen that the lower right molars have big lesions. The shape of condyles are reminders of a possible adaptation to occlusal forces. This may be a result of open bite, but the patient had no clinical symptoms of a TMD. The lateral cephalometric analysis shows us that the patient is slightly high angle skeletally class 1. Her upper and lower incisors are proclined, but the soft tissue values are acceptable. The treatment plan. The objective of the treatment plan was to preserve the soft tissue profile and the smile. The lower molars with periapical lesions were examined by an endodontist and were decided to be treated. The treatment plan was leveling and aligning of the upper and lower teeth, then the intrusion of upper posterior with mini screws. The mini screws were placed to the zygomatic bone bilaterally. In this type of intrusion, molars tend to tip buccally, where the lingual cusps have primary interactions with lower molars and increase open bite tendency. That's why the upper molars should be anchored by a transpalatal arch or two more lingual miniscrews to perform a parallel intrusion. In this case, molar tipping was expected to correct the crossbite, so intrusion was performed only by zygomatic screws. For the intrusion mechanic, night-eye closed coil springs were actively ligated from the molar tubes to the miniscrews. In 4 months of active intrusion, the upper and lower teeth were leveled, open bite was closed, and the crossbite was corrected. At the end of treatment, patient's soft tissue was not changed, but smile was improved. The dentition is class 1 in molars and canines. Open bite was closed and 1 mm overbite was achieved. Fixed retainers were placed for anterior teeth. The lower molars were still surviving. The final cephalometric values of the patient were almost similar to the initials, except the upper and lower incisors inclination with a little improvement. And in this superimposition, we can see that the molars were intruded about 2 mm, the mandible had a little counterclockwise rotation, and upper and lower incisors were also extruded by leveling of the arch wires. You see the initial and final occlusions of the patient. The treatment time was 17 months. So, this is the end of Class 1 Malocclusions webinar. I would like to thank you all for watching.